Hello again. I'm Tom Equals, Chief Executive Officer of AIM Immunotech. Welcome back for another segment of our CEO Corner. Today, I want to dive deep into one of our oncology programs, one of the ones that I think is extremely important. And I'm talking about our phase 2 trial in advanced recurrent ovarian cancer, where we are collaborators with Merck at the University of Pittsburgh Medical Center in a phase 2 funded by a Merck grant, where we're combining Ampligen with Keytruda as a therapeutic for advanced recurrent ovarian cancer. For those of you who do not know what advanced recurrent ovarian cancer is, advanced recurrent ovarian cancer is basically the end of the line for women who have not responded to other treatments, some of which are very successful when ovarian cancer is detected in the early stages. But this is where the cancer is not only advanced, but by recurrent, that means that it is recurring after those therapies. So our work here is extremely important in terms of helping a patient population that is faced with a lethal and malignancy where there is an unmet medical need. But it's also important because it goes to prove one of the important propositions that is a part of our research and development plan for Ampligen in oncology for the future. And that is that Ampligen has the potential to be a dramatic enhancer of effectiveness of checkpoint blockade therapies, where checkpoint blockade therapies are refractory in subjects. In almost every area where checkpoint blockade therapies are used, there are significant refractory patient populations. And as I've explained in prior episodes of CEO Corner, our mechanism of action helps address this by making the tumor visible to the checkpoint blockade drug so that it can then attack and kill the tumor in the same way it does in those subjects where it's initially effective as a therapy. And it can be a very dramatic resolution. But if the checkpoint drug can't, I use the word see, the tumor in a very general sense, if it can't see the tumor, it can't attack the tumor and kill the tumor. And that's what Ampligen does. It lifts the camouflage from the tumor so that the checkpoint drug can work and do its magic. Now, this study started in collaboration with Merck, combining Ampligen with Keytruda in these advanced recurrent ovarian cancer patients in January of 2019. And from its commencement, the investigators could see that something important was happening. And the data in preliminary stages was, I believe, so compelling that it resulted in a number of abstracts and publications related to the important impact of this combination therapy. And that data is published. The protocol for the phase 2 study, which is a 45 subject phase 2 Ampligen plus Keytruda program funded by a Merck grant principally, is going to have a protocol programmed interim report coming out, we believe, before the end of Q1 or before the end of March of 2024. So we have the benefit, though, of two things here. One, that preliminary data, which was published in, I believe it was March of 2022, showed spectacular clinical benefit flowing from the combination therapy. And these are open label studies, so we have a general sense that we should see good data coming out of that interim report. So as soon as we get that report and the top line data, and it's made available to us by Pitt for purposes of announcing it, we will announce that. And I feel very excited about this opportunity because I'm hopeful that we're going to see some extremely strong top-line data flowing from that interim report. Thank you again for tuning in. And I look forward to our next segment of CEO Corner.